Hello everyone, it's Ryan Liberty and welcome back to my series on trauma, everything that you need to know. In this section we're going to talk about the trauma and stressor related disorders. What all of these disorders have in common is that there was exposure to a trauma or a stressful event in someone's life which led to the disorder. Now, we want to distinguish here that this is different from bereavement. Bereavement is a normal process following a loss or a death. However, if it is a bereavement that continues and persists, there is an emerging diagnosis that is not official yet, but they're looking into, which would be called persistent complex bereavement disorder. So if that's something that you think may be going on, you may want to look into that. But as far as the trauma and stressor related disorders go, these are the ones that we will be talking about. They are reactive attachment disorder, disinhibited social engagement disorder, post-traumatic stress disorder, acute stress disorder, and adjustment disorders. Now, before we get into what each of the disorders are, I have to say that this is not diagnostic criteria and it cannot be used to diagnose anybody. If you're looking for a diagnosis, you'll have to speak with a licensed professional who will be able to diagnose you or the loved one that you would like to know about. Trauma and stressor-related disorders in children. When it comes to trauma and stressor-related disorders in children, there is an important distinction that we need to make with regards to post-traumatic stress disorder or PTSD. Some of the symptoms of PTSD in children may appear like normal playing. Something else to talk about is that there are two disorders that are specifically diagnosed in children, and those are reactive attachment disorder and disinhibited social engagement disorder. They both share in common that there was insufficient care for the child as it was being raised. Examples of insufficient care include having their emotional needs unmet, having a primary caregiver that is routinely switched out so attachment cannot be made, or being in an environment where an attachment to a caregiver is not possible. For both of those disorders, the symptoms have to be lasting for more than 12 months. Reactive attachment disorder. Reactive attachment disorder is rare. It's seen in less than 10% of populations of children who have been severely neglected. When we diagnose reactive attachment disorder, we look for it in children under the age of 5. It's characterized when a child is emotionally withdrawing from a caregiver, and the child has emotional and social disturbances as seen in their behavior. Some examples of this are having minimal emotional responsiveness to others, having little positive affect or emotional expression of positive feelings, and having unexplained irritability, fearfulness, and sadness with relation to the caregiver. It's important to note that reactive attachment disorder is not autism spectrum disorder. Disinhibited social engagement disorder. Disinhibited social engagement disorder is also rare. It's seen in less than 20% of populations of severely neglected children. Disinhibited social engagement disorder is characterized by a willingness to interact with unfamiliar adults, and that's not due to impulsivity. Examples include having reduced hesitance in interacting with unfamiliar adults, having overly familiar verbal or physical behavior with those unfamiliar adults, having less looking back towards the caregiver when venturing off with an unfamiliar adult, and then having willingness to go off with an unfamiliar adult. Post-traumatic stress disorder. About 9% of people will develop post-traumatic stress disorder or PTSD in their lifetimes. I go into greater detail on the symptoms of post-traumatic stress disorder in the section on trauma symptoms. All of the symptoms listed there are symptoms of post-traumatic stress disorder. To briefly summarize the categories of symptoms here, they are intrusion symptoms, avoidance symptoms, anhedonic symptoms, dysphoric symptoms, arousal symptoms, and dissociative symptoms. Post-traumatic stress disorder has to be occurring for more than 1 month to be diagnosed, and it's worth noting that people with post-traumatic stress disorder have an 80% more likely chance of having another disorder than people that do not have post-traumatic stress disorder. Acute stress disorder. Acute stress disorder is seen in less than 20% of people who've experienced a trauma recently that was not interpersonal assault. For people who have experienced trauma that was interpersonal assault, the rates of acute stress disorder are 20 to 50% of people. The symptoms of acute stress disorder are the same as post-traumatic stress disorder. However, the duration after the end of the traumatic event is from 3 days to 1 month. Adjustment disorders. Adjustment disorders are common. However, rates of adjustment disorders vary across populations. Adjustment disorders are behavioral and emotional symptoms that arise within 3 months of an identified stressor. Those symptoms will go away after 6 months of that stressor terminating. The reaction to the stressor is marked and it is out of proportion to the severity of the stressor. This results in significant impairment in social and occupational and life functioning. The symptoms of adjustment disorder include anxiety, depression, mixed anxiety and depression, disturbance of conduct, and mixed disturbance of emotion and conduct. Some examples of the stressors include the end of a relationship, marital problems, painful illness, disturbance in business, natural disaster, living in a high crime area, and unfulfilling sexual relationships. Trauma and stressor-related disorders. All of the trauma and stressor-related disorders have in common that they are a reaction to a traumatic or stressful event. This is different from normal bereavement, which is when we experience a loss or a death. However, if that bereavement continues on and it persists, there is an emerging diagnosis that is being studied. It is not an official diagnosis, but it is called persistent complex bereavement disorder. The trauma and stressor-related disorders are reactive attachment disorder, disinhibited social engagement disorder, post-traumatic stress disorder, acute stress disorder, and the adjustment disorders. As a reminder, none of the information in this section can be used to diagnose anybody. If you need a diagnosis, you'll have to see a licensed professional. If you have any questions or comments about any of these disorders, maybe you or a loved one has one, please leave that down below for the community. And if you're enjoying this series on everything that you need to know about trauma, please subscribe.